There are over 7 billion people in the world, and all are bound to get sick at some point. Beyond the day-to-day colds and illnesses, a growing number of our population has chronic health conditions, and even healthy individuals have preventable and acute healthcare needs. Of the 317 million people in the United States, most will lead happy, healthy lives, but 70% will miss one or more days of work and school each year due to acute or chronic illnesses. Clinicians, public health officials, and researchers get up every day trying to figure out how to improve the health of society. They have the ideas, the tools, the inventions, but how do they know where and when to apply these solutions? We thought we could help save all of them time and money by providing them with more accurate population health data integrated directly in their workflow. We do this by applying our proprietary algorithms to electronic health record data and presenting it in an easy-to-use web-based portal. The HealthGEO team applied to the DC I-Corps program to understand if we had a commercializable product. As academics, we were lost in all the terms and jargon: customer discovery, value proposition, customer channels. The teaching team gave us a defined path, walked us through the business model canvas, and sent us out of the building to test our value propositions. We started out by talking to anyone in the healthcare industry who would listen. We spoke with clinicians and administrators in large hospitals and health systems, but got a lot of nice to have on our value propositions. The clinicians said, "The data's great, but I don't know how I would use it." The administrators told us that it sounds great, but we have repurposed some of our resources to do just that. We began to understand the health system archetype and got better at asking questions. The more interviews we did, the closer we came to understanding that individual clinicians did not know how to use our product. We thought we were finished, ready to close up shop and go back to academia, having failed at our role as entrepreneurs. But then one of our interviewees said, "Why don't you talk to private physician practices?" Turns out, these practices are under increasing pressure from insurance companies to provide better population health, and don't have the resources large health systems do to figure out how. We found out that they are extremely short on resources and were being required to comply with new population health incentives, like patient-centered medical home and accountable care initiatives, in order to receive full reimbursements. Further, we found out that they were all struggling to conform to reporting requirements, with usually a single person doing the reporting for the entire practice. They told us that they need a way to comply with the population health requirements and began to understand how to use the data effectively. Hearing that, we pivoted and began focusing on this new customer segment. We thought we were back at square one, but quickly realized we had gained some valuable customer skills along the way. This new pivot opens up a world of new potential customers to interview to better understand this new ecosystem. The teaching team at I-Corps have given us a roadmap and set us up with a solid foundation. We will continue down the road of customer discovery and to find a place where HealthGEO's technology can be used to improve healthcare across the globe.